A local doctor, meanwhile, likens new CDC advice on COVID-19 vaccine boosters to insurance, and he says he's just not ready to buy full coverage.
While the FDA okayed a fourth shot for folks over 50 yesterday, there's still questions about where it leads.
WCPO 9 News reporter Larry Seward is live outside UC Health's pharmacy right now over in Clifton. Larry, the FDA's move surprised some in the medical field.
Yeah, Craig, it definitely did. And in and around vaccine clinics like the one behind me, it fired up discussions about what a fourth dose does and does not do.
One of the voices leading Cincinnati's COVID-19 response, encouraging vaccination and boosters for months, sounds skeptical of the Food and Drug Administration's latest offer.
I actually am not going to rush to get a fourth dose.
With immunity waning 4 months after some fully vaccinated people took booster shots, the FDA authorized a second round for people over 50 and those with weakened immune systems like transplant survivor Kelly Thorne.
Even though I'm vaccinated and my immune is still weakened, you just still worry. Like, what if I catch it from this or going in the store?
But outside those high-risk crowds,
it's almost in the category of wearing masks, in a sense. An extra amount of protection.
Dr. Stephen Fagans hardly thinks the second extra dose is essential.
Not so sure in terms of myself and my family. I believe in America we don't have the ability to give doses of boosters every 4 months in perpetuity. And we still have over 50% of our population who received the first 2 doses who have not received the third dose. And that's really a focus on us.
In Indiana, Reed Health's chief medical officer told us in September most of the COVID deaths in his hospital that serves Franklin County involved unvaccinated patients.
75% of our deaths are in that category, and that amongst those who have had initial vaccination but not received any boosters, there's also a significant death burden.
For such reasons, researchers think the first booster could turn Pfizer and Moderna's mRNA standard vaccinations into 3-shot series. But with an Omicron subvariant spreading in Europe, doctors wary of a potential surge here think the second booster is available as a just in case.
It's really unpredictable whether or not there'll be a surge of cases, and it's even more unpredictable. Will there be a surge of cases in your neighborhood?
Larry Seward, WCPO 9 News.